Good afternoon. Hi, Felicia.
How you doing?
Good. So we're happy to have you all join us. We're here to talk about COVID-19 and the vaccine.
Right.
Why don't you tell everyone who you are?
Okay, I'm Felicia Wilson. I'm a pediatric hematologist oncologist here at South Alabama and a COVID-19 vaccine trial participant.
Oh, wow.
Yeah.
I'm Errol Crook. I'm the Department of Medicine chair at University of South Alabama. I am a COVID-19 survivor and a COVID-19 vaccinated person times one. So there are a lot of talk going on around COVID-19. The vaccine is out there amongst our healthcare workers, even at South Alabama, but nationwide. There's a large number who have real concerns about whether or not to get the vaccine. And what we're going to do today is to chat about that,
Right.
and safety and some of those issues. So would you tell me some of the things you're hearing as to concerns about the vaccine?
Right, I'm hearing concerns from African Americans dating back to the Tuskegee experiment, where the participants had syphilis and were followed for 40 years untreated despite penicillin.
Right.
And so there's some fear still related to that. I'm also hearing about the speed at which the vaccine was made is problematic for some.
Yeah.
Yeah.
You know, that Tuskegee thing is, you can't help but
Right.
be concerned.
Sure.
And now it's been decades of knowledge about what happened.
Right.
Probably more importantly, what didn't happen.
What didn't happen, that's
And I
right.
think it's important because I'm a native Alabamian, and you've been here long enough now, we can claim you as a
That's
native,
right, 30 years.
And so, you say the word Tuskegee, but then the conversation kind of stops. And you pointed out that it was an issue of a known effective treatment was identified,
Right.
but wasn't given,
Right.
supposedly in the name of science, so that you can see what happens when you don't treat something. So I think that's a different scenario than what we're talking about here.
Oh, for sure.
In fact, if someone elects not to get vaccinated because of their distrust, in fact, what they're doing is putting themselves in the same position as the participants in the Tuskegee study were.
Exactly, that's a good point. I think too, one of the things we have to realize is because of the Tuskegee experiment, research is done a lot differently now. I can show you my consent form being in the study. Look how thick that is. Mm-hmm. So some of the things that came out of that helped research move forward and be honest and transparent.
Right.
So we have to think about that.
Right.
But I like your point that if you are not getting the vaccine because of that, it's the same thing as the people who were in the trial not getting a treatment that was available.
That's right. You mind sharing which trial you were in?
I was in the Pfizer trial.
Pfizer trial.
And let me tell you why that was important to me. First of all, as a pediatric oncologist, most of the oncology treatments for patients have moved forward because of clinical trials. Mm-hmm. So that's what I do every day. Mm-hmm. I ask parents to enlist their children in clinical trials so we can make their outcomes better and the side effects less. So I was familiar with the scientific process, but on a more personal level, I had a respiratory infection in March 2018. I was fine before that. Couldn't even tell you the last time I had the common cold. And as a result of that infection, I started wheezing, but I developed asthma. And so every time I would come off of the inhaler, I would start wheezing again until my doctor finally said, "You have late onset asthma." So, I'm a little leery about respiratory infections.
Right.
So I didn't trust that me having asthma, and by NIH standards, a little full-figured, that I might do okay if I got sick with COVID.
Right. Right.
So I wanted to be a part of the trial, first of all, to try to get the vaccine early.
Right, right.
No, but also to help move the science forward. And some of the things that should be reassuring to us is one of the viral immunologists at the forefront of that research, Dr. Kizzmekia Corbett, an African-American woman,
Right.
was at the forefront of
Yep.
this.
Yep.
And the first African-American person that I knew in Alabama that got the vaccine as part of a trial was a physician.
Wow.
And I saw her on the news one day. And actually, it was my husband who said, I want to be a part of that. And so we found the information, signed up for it. I got a call, he didn't. I had a friend who was a nurse in infectious disease for 40 years. She signed up and didn't get, called. But again, it was trusting the process. And by then we already knew in many places African Americans were maybe making up 25% of the population, but 50% of the cases and
Right.
deaths. So
Absolutely.
it was showing us what it could do.
Right, right. And I think we owe you and other participants a debt of gratitude for participating in that trial. And I think it's really important to reiterate that there were scientists of color,
Yes.
scientists who come from similar backgrounds,
Right.
a part of the study, that there are participants of similar backgrounds part of the study. In fact, in the presidents of the 3 historically black colleges and universities in New Orleans all participated, all sent joint letters to all of their staff and students. And you think about their staff and all their students, undergrad and graduate students, that was thousands, and encouraged them to
Yes.
participate. So we had leaders out there saying do so. So we have data on
Right.
us,
That's right.
which is important. And
Right.
because that's one of the concerns, if I walk around the hospital and talk to people as to whether or not they had a vaccine, because I expect people to have concerns.
Oh, sure.
And one of the most common responses I get is, I'm waiting to see.
Right.
They don't even say, see what happens. I'm just waiting to
That's
see.
right.
And I think that's clearly understandable. But
Sure.
what I would like to point out is that the trials have now been going on for over 6 months.
That's right.
So we have 6 months of data. And when you put together, particularly Pfizer and Moderna, around 80,000 people.
Yes,
It's a lot
yes.
of people.
Right.
And so we have good data to understand that the safety is there, and more important, the efficacy is there.
Right. And it's important to note, too, that even though the vaccine has emergency use approval, the trial is still ongoing to study the people who have
Right.
received it.
Right.
And every week I have to pull out my phone and pull up an electronic diary and enter any symptoms that I have, and then there's a list of symptoms that I can answer no if I didn't remember what they were. So they are still studying the effects of the vaccine in individuals who have gotten it.
Right.
Now, incidentally, I got the placebo. So when the emergency use approval was obtained, then they did allow those who were healthcare professionals, first responders, or nursing home employees to unblind the study, because we didn't know whether we got the actual shot or the placebo, and offer you the vaccine.
Well, that's
So,
wonderful.
yeah.